Hi, everybody. Welcome to your lecture on policies in public health nutrition. I'm going to give you sort of the basics of policy today so we can spend our time in class doing more hands-on activities. So a couple of things you should take away from this recorded lecture: the definition of a policy, pretty simple and straightforward. We're also going to go over the steps involved in formulating policies with an emphasis on the process and challenges of making policies evidence-based. We're going to go over the main categories of the important food and nutrition policies that impact the dietetics profession and public health nutrition profession, and overview how the funding works. And we're going to give a few examples of how nutrition science and research shapes food and nutrition policy issues. So right off the bat, here's your first objective, the definition of a policy. There are many definitions. The one we'll use in this course is simply a course of action chosen by public authorities to address a given problem. Now in class, we're going to practice making policies and look at some existing policies. So I'm just going to briefly describe some of the different ways we go about making a policy. So there's different models, there's different theories. We're going to spend most of our time in class looking at the STAGES model, just because it's most similar to the nutrition care process, which is another important process that you will know very well. So if we think about making a policy as going through different stages, the first one is agenda setting. That's where you identify a problem that needs a policy. So your agenda may be too much added sugar in the American diet, too much sodium in the American diet, not enough opportunities for women to breastfeed if they choose to do so, unclear labeling on foods, problematic deficiencies in the American diet. So there's all kinds of good examples of problems that need a policy. Once you have a good idea of your problem, and that agenda setting takes a long time because you want to be very careful about it. But once you are, you can start to formulate your policy. So this pertains to the means by which the problem will be solved. You also have to think about the intended impacts and possible unintended consequences. So maybe you come up with a wonderful policy. I'll give a historical example of low folate and its impact on pregnant women and neural tube defects, and our policy to start fortifying our grain products with folic acid to prevent this. Of course, we wanted the impact to be fewer neural tube defects, but what might be some unintended consequences? In the case of folic acid, the entire public was being exposed to folic acid, not just the real target population, which was pregnant women. So were there any segments of the population who might be harmed by too much folate? Those are all examples of things that you have to think about when you are formulating a policy. Once the policy is formulated, it goes through an adoption phase where anybody who cares about the policy, is impacted by the policy, is involved in getting the policy approved, have to agree to the terms of the policy. So those might be stakeholders, which is anyone who cares, partners with common interests, so very broad. Hopefully your policy is adopted, and then it is time to implement the policy. So setting in motion the activities supporting the policy. So now it's going live, it's actually happening. And if you are good at what you do, then you know that you have to evaluate everything. If it's a brand new policy, then you hope you did everything right, but there's probably some mistakes or things that you didn't think about. So if you're evaluating the policy and looking at whether or not the policy is working, that way you can make sure that it doesn't need any tweaks or changes. So if you want to make that correlation between that stages model and the nutrition care process, this is the sort of side by side. So the nutrition care process is step one, assessment. That is going to line up with the agenda setting. You know, when you're gathering all that information, getting all your good data, so you can really identify the problem. That is also very similar to what you're doing when you perform a nutrition diagnosis, honing in on those key factors that are important. Step three of the nutrition care process is the intervention, when you're actually doing something that corresponds to steps 2, 3, and 4, where you are coming up with the intervention or the policy, you're adopting it, and you're actually implementing it. And of course, step 4 of the nutrition care process is evaluation. And again, we want to always evaluate our work when we're done. So why do we do this? You know, it's boring, I would believe. I can't imagine what you're thinking sitting here talking about assessment, diagnosis, intervention, and evaluation. But there's a reason why we do processes. We're more thorough. We're less likely to leave anything out. You know, it really helps us be consistent and make sure we're dotting our I's and crossing our T's. So if we follow it and we take it seriously and we go through all the steps diligently, hopefully the benefit is we don't make any mistakes, or if we do, they're very minor. Here's some example of some national policies, laws, rules, regulations that were intended to accomplish certain goals. So these already exist. These are federal policies. The first one is overseen by the United States Department of Agriculture, and they are the group that sets nutritional standards for the national school breakfast and lunch programs. So if you participate in the school breakfast or lunch programs, there are rules or guidelines or policies, if you will, about how much sodium and calories and servings of fruits and vegetables and all of those things. So those are essentially laws or policies that need to be followed. The Federal Drug Association, or FDA, sets our labeling regulations. So think about food labels and oversees food fortification. The Center for Disease Control, or CDC, their Early Care and Education Act, make sure that our public health practitioners, child care providers, and decision makers are up to date on anything in their state. And this is basically a research agenda, especially as it relates to obesity. And probably the biggest policy-related agenda item for public health nutrition is the Farm Bill. The Farm Bill is quite extensive. These are all of our agricultural policies. So think about how we grow food, distribute food, sell food. The Farm Bill also encompasses a lot of our programming for public health nutrition. So it really impacts healthy eating efforts both locally and nationally. Now, policies don't have to be federal. They can be any type of law, rule, or regulation, even at a much more local level. So if you think about the town or city that you live in and how they might impact public health, something as simple as a zoning or licensing law, or other types of incentive programs help regulate fast food outlets. So if you have a zoning law that doesn't allow fast food or large chain restaurants, that would certainly possibly impact people's eating choices and eating behaviors. It can work the other way, where certain land is designated for things like grocery stores to avoid food deserts, which we know can lead to poor nutrition. State or local laws can also do things like tax soda. There are certain cities, I believe San Francisco is one of them, where they do tax soda and they use that extra money for health education. mandatory labeling of calories. When we first banned trans fat, that was at a very local level before it went national. Some states have standards about food and childcare settings. Most of them, unfortunately, do not. But certainly you can see how that would be influential. You can also have policies in your own workplace. This is becoming more and more popular, which I think is a wonderful thing to see, where there's policies that promote healthy eating environments in your place of business and schools as well. Where an example of in a school where we might ban, I can't even think of them, vending machines, or maybe people aren't allowed to bring in junk food for holidays and birthdays. A lot of businesses have policies about, paternal leave or maternal leave after somebody has a baby. Maybe policies about allowing women breaks to breastfeed, having longer lunch breaks in order to do physical activity. All those good things. If you're interested, feel free to look at the link and just see some examples of that. So who makes policies? The answer simply is anybody can make a policy. This is just a list of people who would be maybe more likely. We definitely tend to think of it as more of a political type of action, and certainly our politicians are very much involved in policy making, but street level bureaucrat would be anybody who might be interested in a certain issue. And of course, I would be remiss not to put public health nutritionists on this list. This is probably from a social studies class you may have taken in grade school, but we're just going to kind of quickly go over the simple 1, 2, 3 of how an idea becomes a law. So it usually starts at the ground level, where a citizen, a group of people, an organization brings an issue to the attention of a legislative representative at the local, state, or national letter. So how do you get their attention? Maybe you start a petition. Maybe you start something on even social media these days. Maybe you get as many people as possible to start writing letters to their local politicians. There's many ways to get someone's attention. Once it gets into the right sort of branch of government, a bill is written and submitted to the clerk, where it has an official number. It gets printed, so all of this has to be very transparent. It has to be sponsored by at least one legislative member in the House or Senate or both. How do you get politicians to sponsor a bill? Well, politicians are supposed to be working in the best interest of the public. So if they believe the public, the majority of the public wants something, they would be more likely to sponsor it. Next, the bill is referred to a committee and subcommittee, so all kinds of different committees in government. This process, or these steps, go on and on and on, sometimes for years and years and years. So this is often not a very quick process at all. This is another picture, especially if you're not really knowledgeable about U.S. government, or you haven't learned it in a really long time. We have our 2 branches of Congress, the House of Representatives or the Senate. Again, after it gets that far, it goes to whatever committee or subcommittee that it belongs to. It gets voted on at the smaller committee, and then it goes up in front of the full Senate or the full House. At that point, they formulate the bill. The House and Senate vote on it, and the president gets the final say. The president can also veto or kill a bill. So once it's been approved by the House and Senate, that's when it does go to the president, who is currently Donald Trump. He can sign the bill into law, so presumably that's what he's doing into that picture. He can veto it, but Congress can still override the veto with a 2/3 majority. If he ignores it, it goes unsigned for 10 days. If Congress is in session, the bill automatically becomes a law. If they're not in session, it actually automatically gets vetoed. So isn't that interesting? If it is approved, the law is referred to whatever agency would be responsible for issuing the guidelines or regulations. This is an example that's relevant in our world of a bill that went through. So the final rule means that it passed. So this particular bill passed in 2014 after many, many, many years. And it was a rule change that did a couple of different things. Usually these are fairly lengthy and include more than one thing. In this particular case, what pertains to registered dietitians is it allowed dietitians to order patient diets independently, which they are trained to do without requiring the supervision or approval of a physician or other practitioner. It is important to note that this change only applies to registered dietitians, nutritionists privileged by the hospital in which they work. So before this bill went through, if a dietitian felt someone should be on a cardiac diet or a pureed diet or whatever medical nutrition therapy that was prescribed, it had to be signed off of by probably a physician. Now a dietitian doesn't need anyone to sign off on it. He or she can prescribe that herself or himself. Although a hospital has the final say. So if a hospital still has within their internal policy that it has to be signed off by someone else, then it defers to whatever the hospital wants. If you really are having trouble sleeping at night, you can click on that link and read the full, very legal terminology bill that got passed. You should also be somewhat familiar with the budget process. This always becomes a big deal when the budget has to get approved. It's essentially looking at how much money is available to fund programs, and many of the programs that we care about are funded by the government if they're for public health. So two sort of broad categories. One is mandatory spending, programs that require payments to anyone who is eligible. So Social Security, Medicare, and SNAP would be an example of that. If you are eligible to receive those, there's no question you absolutely will. There isn't sort of a cap. It doesn't run out. It's a guarantee. Discretionary spending has to get approved every year. The largest portion of our discretionary spending budget is the military. Head Start and WIC also fall into that category of discretionary spending. The president's budget is provided every year to Congress. And again, every year it usually turns into quite a battle, which can lead to things like government shutdowns when Congress and the president are not in agreement. Often it's usually the Democrats and the Republicans who are not in agreement. I'm sorry, this is old from 2011. The numbers, percentages are not so important. Just pay attention to the red and the blue. So the red is that mandatory spending. The blue is the discretionary spending. On the left, you can kind of see, where our budget goes for that defense. That would be the military that makes up a big chunk of the pie. A lot of the programs that we might be interested in fall into the other mandatory part of the budget. I think we mentioned earlier that the food stamp program is our largest sort of public health nutrition program. But at the end of the day, it still only makes up less than 3% of our total country's budget. So certainly important, but isn't, everything that we're spending our money on. Some other budgeting terms you should know: budget authorization if it's the first time, reauthorization if it's existing sort of spending item is what establishes a program budget. It tells you the ceiling on spending, the most that can be used. It doesn't actually provide any money. That's when you need the appropriation. So once the budget is authorized or reauthorized, it will eventually get appropriated, and that's where the programs get the money to run their programs. There's some flexibility here. Sometimes the budget is just for 1 year and they have to kind of go up every year. Sometimes it's a multi-year appropriation, or sometimes it's indefinite and it keeps getting funded every year. I'm going to quickly go over the current legislation and emerging policies, issues, and nutrition. If you think about, the goal of public health nutrition, we do want to balance fiscal responsibility. So we want taxpayer money to be spent wisely. And what are we caring about? We really want to make sure that the public has safe and affordable food, education, access to quality health care. And what is the best, most cost-effective way to do that. So our big four that we really pay the closest attention to is first, disease prevention and treatment, life cycle nutrition, so thinking about our vulnerable groups, healthy food systems and access, and making sure that we're providing quality health care. I've given you sort of some picture examples of sort of hot policy issues: school lunch, sustainability, agricultural, buying local, dietary guidelines, all those good things. I'm going to go over some of the policies that are in the works right now that we're hoping will pass. If you're ever sort of looking for a topic to write about, if you have to write a paper or do a project on policy and you want to pick something in the field, these would probably all be good choices. Breastfeeding in the workplace is an interesting one. These are federal, so going up at the national level. And they're really hoping that employers will have to provide a reasonable non-paid break time for an employee to express milk. So pump her breast milk, and have a place that is private and not embarrassing for her, that's clean, in order for her to do that. So this has the obvious public health nutrition impact in that we want women to be able to breastfeed. We want to support breastfeeding, promote breastfeeding. And that's why we would like for this law to be passed. Preventative Health Savings Act. Anytime you hear the word prevention, you know it probably has to do with public health. If you kind of read through the bullets here, you of course know that chronic disease is for the most part preventable, or at least you can slow down even if you have a high genetic risk. The purpose of this act is actually to get more money for research. So they want to provide Congress with a more accurate assessment of the long-term healthcare savings associated with preventive programs. So basically, I think we all believe that prevention ultimately saves money because people aren't getting sick and going to the hospital, which is very expensive. And even though we think that, we struggle to sort of prove it with research. So that's what they need. They need more money to do that type of research. This one really needs to go through. It's been hanging out too long. If it sits in the cycle too long, it actually has to start over. The picture on the right hand of the screen is just sort of some educational awareness that is used to try to get the public behind this and interested in it in order to help push it through. So Older Americans Act reauthorization, meaning it's not the first time. Part of this act one of the proposals is that there's language that qualified nutrition staff is included for some of our elder-based programming, so that nutrition screening, assessment, counseling, and education can be done by someone who is qualified. So if you have an act that requires that, for example, a registered dietitian or a public health nutritionist be on staff, if it services more than X number of people, it certainly helps promote the profession. And of course, we would all think that it would help ensure that our older Americans are getting the highest quality care that we can provide. This is a doozy, the Healthy Hunger-Free Kids Act. I think all of us know that that was responsible for the school lunch overhauls, but it actually did much more than that. It increased the budget for a lot of our child nutrition programs. It had more impact than just school lunch. It also had, introduced some rules about food sold outside of the school. Elevated the status of school nutrition professionals, made minimum qualifications for people who ran food service in schools, got more money for the farm to school, so there was more gardening programs because of this, more money for after school meal programs, and more money for WIC to support breastfeeding. So again, a lot of this is thanks to Michelle Obama, who really took this on as one of her key initiatives while her husband was in office. Diabetes prevention. Right now, Medicare allows or reimburses for its participants to be seen by a registered dietitian for medical nutrition therapy. We would like to extend that so it also covers people with pre-diabetes. So don't just wait till someone has the disease. Give them the care that they need. Make sure that their insurance, in this case Medicare, covers it. So hopefully we can prevent that. Gestational Diabetes Act is, again, asking for more money for research, so more surveillance data and public health research on gestational diabetes, which is really also preventative, because we know if a woman has that, then she's more likely to get type 2 diabetes later in her life. This is the Farm Bill. I like that little picture at the top. It's like a Swiss Army knife because it really is very broad. It used to be just, what do farmers in this country grow and what's available in our food supply. But now the Farm Bill also focuses on things like food safety, food assistance, and the environment. The reason why we care so much about it is the Farm Bill's budget is used for SNAP, CSFP, TEFNAP, and the Fresh Fruit and Vegetable Program. So all of those things that can help keep the public healthier. So if you're interested in the Farm Bill, I included a link there for more reading. Of course, this is an area where we would like it to be well funded, because we want more money for these good nutrition programs. You should know what a block grant is. That's why it's in red. So a block grant is a grant from the central government, so the federal government, that a local authority can allocate to a wide range of services. So, you might have a small little program in Lowell, Massachusetts, and a block grant would come from the government that you could use to maybe improve or expand your services. This could be used for food safety, research, getting more fruits and vegetables into the hands of the public. We also want more incentive grants. These are very important to improve access and reduce the cost of fruits and vegetables for SNAP, WIC, and elderly recipients. The Healthy Incentive Program, or the HIP program, is a great example of that, where you can use your SNAP dollars, and if you're buying fruits and vegetables, especially if it's at a farmer's market, you get even more money, and that is covered by these incentive grants from the government. And of course, we want money to make sure that research continues to go on so we can continue to monitor our food supply and eating habits. Here's another example of a bill that is in the works right now. This one is asking more coverage for dietitians to treat obesity through intensive behavioral therapy, so nutrition counseling, and get more coverage through insurance for weight loss medications that can go along with intensive behavioral therapy. This is evidence-based, so when you are trying to get these through, you should have some research to show that it will be effective. And of course, the more insurance reimbursement we can get for our services, the more people we can help at a lower cost. So always something that's important to the profession. So if you kind of think about these policies that I've showed you, you'll notice that there is a common theme. All of them I showed you, of course, were about public health nutrition, either getting more money for programs, getting more reimbursement, really promoting the profession. I think even if you aren't really interested in any of this, you're probably interested in making a good salary someday. So the more that some of these bills, if they eventually get passed, that does sort of elevate our professional status and usually means we can charge more for our services. Having said this, most people don't really get involved in the policy part, even if it affects them personally or professionally. So we always want to sort of keep things highlighted. We're going to talk about how to do that in class and talk about how to get more involved. The major way I do that professionally is by being a member of the Academy of Nutrition and Dietetics. We have one major sort of arm that deals with policy. That's the Political Action Committee. They raise money, so when I go to pay my dues, I can give them extra money. They have lobbyists in Congress trying to get some of these bills that are important to our profession through. Lobbyists are professionals who provide technical information to policymakers. It's their job to help get these legislation things passed. Another easy way to kind of get involved is, if you think back to that first step of policy making, you have to make sure your government officials know that you're concerned. So let them know. I think most people just email these days, but you can do a handwritten letter, you can fax, you can call people up on the phone. You can try and get others to care. You can do that through social media or just talking to people, going to conferences, all those good things. So hopefully you will find a way to be involved at some point in your education or career. All right, we're going to end the lecture with an example. This is titled "The Widespread Effects of Food and Nutrition Policy on Public Health Using the Dietary Guidelines as an Example." So if you know anything about the dietary guidelines, you know that they're updated every 5 years. You may or may not know they have a very strong influence on a lot of our nutrition policies in this country. And it won't surprise you that there's a very well-defined process that goes into updating the dietary guidelines. So if you kind of look at the schematic here, you can see step 1, we charter, so basically get things started. A committee is actually selected and they put all of their meetings online, so people know exactly what they're talking about, exactly what they're doing, and they start with reviewing the science, the nutrition science that goes into the policies and the dietary guidelines that we eventually make. They end up writing a summary report that goes to the Secretary for the USDA and the HHS, Health and Human Services. that's when the actual policy gets written. I have that circled because the process starts with experts in the field, mostly nutrition scientists, and it actually gets written by politicians, which maybe isn't exactly what we would want, but that's the way that it's done. And the dietary guidelines get implemented through federal programs. So this is where we might be making changes to the food label or the school lunch or Head Start or WIC. This is where we might change the way the pyramid looks and turn it into a plate, all of things that have happened in the past. Another important take-home point about this is it is based on science and evidence, and we can only use it on the evidence that's out there, so things that have been published. This is actually a kickback to the 2015 dietary guidelines. Most people don't know this, but they were really hoping to talk about sustainability in the last dietary guidelines and starting to recognize the impact of food and beverages on environmental outcomes. So thinking about, this says farm to plate waste disposal, so food waste, and to start thinking about how our food choices affect sustainability in the environment. We also should be thinking about our food supply. And as we experience things like climate change, are we always going to be able to grow and raise all of the food we need in order to be healthy? So sustainable just means long-term, right? Thinking ahead, thinking to the future. I find most public health people are pretty good at recognizing the link between our food choices and our food packaging and the environment. I will tell you that sustainability was not included in the 2015 dietary guidelines, and this was probably most likely a political reason. If this were added to the dietary guidelines, there would probably be things about maybe meat consumption and its impact on the environment. And, that doesn't make everybody in this country happy. So it ended up being quite political. At the end of the day, it was decided in Congress that the dietary guidelines will not include the goal of sustainability. The rationale being, that's not part of our mandate. We're here to provide nutritional and dietary information. This has nothing to do with the environment. So I show you some pictures down here to sort of think about what might be some hot button issues. So I show a picture of almonds, right? Almonds are healthy. They're a good source of protein and fiber, and vitamin E, potassium, magnesium. Supported, of course, by the dietary guidelines. It tends to be sort of our go-to nut, but almonds actually require a tremendous amount of water to grow. So could we perhaps, because we care about sustainability, do a better job promoting all different varieties of nuts? And so people don't just think of almonds when they think of nuts. So kind of the same message with the fish. I think people have a tendency to believe that salmon is the best fish and the only fish, when in fact we're going to probably run out of salmon because we eat so much of it, and our bodies of water aren't in the best shape right now. So another type of messaging that we could maybe do a better job promoting, but we don't seem to have the funding for. Does eating more meat have an impact on our planet? That's actually very, very much debated. I think most people believe that Americans probably eat a little bit too much meat, and other segments of the world could probably benefit from a little bit more meat. Certainly there is an imbalance. You might have seen a graph like this. I've certainly showed it a lot. It's talking about the environmental footprint of our food choices, suggesting that people who eat a lot of meat have more of a carbon footprint, just because of the methane gas, for example, that cattle let out. the amount of energy and resources it takes to raise live livestock. And then on the opposite end of the spectrum, people who do not consume meat, like vegetarian and vegans, don't impact the environment in that way. Some of this data is actually a little misleading. I don't think you should feel tremendous guilt if you eat meat. We're actually going to talk about that towards the end of the semester. This, however, is a real issue that I don't think we talk enough about. So if everybody followed the dietary guidelines, and wouldn't that be great, we wouldn't be able to keep up with food production. So people would eat more fruits and vegetables because they need to make half their plate fruits and vegetables. We'd need another 9 million acres to grow enough vegetables for all those people, another 4 million to grow the fruits that we needed. We'd have to convert some of our wheat because we eat too much wheat in our processed grains, probably convert it to more fruit and vegetable growth. And if people really did drink their 2 to 3 servings of dairy every day like we recommend, we'd have to produce way, way, way more milk. So could we even do this? Probably not. Aquaculture is another interesting thing. So agriculture is growing food from soil. Aquaculture is our food supply that comes from our lakes, rivers, and oceans. Most of the fish we consume actually comes from aquaculture farms. Surprisingly, I think a lot of us think that someone's out there fishing for all that fish that we eat. Right now, most people believe that wild salmon is the healthiest type of salmon, but we simply do not have enough to keep up with demand. And if people ate as much fish as we told them to, we really wouldn't have enough. So it's very important. We know that fish is a healthy food, but we really have to take better care of our water. We have to have more sustainable both agriculture and aquaculture practices to make sure we're going to be able to provide all this healthy food to the people, especially as our population continues to grow with better health care. So one of the things that I recommend to clients, patients, I also try to practice it myself, is to eat more of a variety. I don't eat that much salmon anymore, even though I love it and I think it's great for me. There's other types of fish. So just small ways that we can sort of diversify and promote healthy eating. So at the end of the day, an important message here is policy making. I think we're familiar with the things that directly impact us, but hopefully we'll move beyond the basics and really start thinking about the food and environment connection. That usually means we have to go outside of our comfort zone. So we want to be interdisciplinary and work with people who do have a better understanding of things like climate change. There's a lot of technology and innovation, especially in farming and aquaculture, that we need to start caring a little bit more about so we can make sure our food system is sustainable, safe, and able to provide a lot of healthy food. And always go back to evidence-based and make sure the science is there to match it. And the last slide, I just want to give you a little update. This is a screenshot so you can see where I got it, which is basically health.gov. They are in the process of updating the dietary guidelines for 2020, right? It's almost here. And if you're curious about where they are at, they are now receiving public comment. So if you want to put your little mark and make your comment, they want people to know, or they want people to chime in about the process. They also have some different protocols, so the questions that they're trying to answer, so they can make sure that the 2020 guidelines are about things that people care about, that the process they use to sort of analyze and summarize the data is robust. So that would be another way you could get involved in sort of the policy aspect of our profession. Although that did expire July 24th, but still look at the website and see what's going on.